Hello, everyone. It's the April the 16th, and this is our briefing. I'm sorry we're a little late getting started. I've just been on a call with the president and the vice president, and it started at 3 o'clock, and it's lasted a little longer than what I anticipated, so I'll get to that in just a few minutes. But first and foremost, I always want to lead off with this because it's the most difficult of all, and it's what should always be on our thoughts and prayers, or on our minds rather, with all West Virginians. You know, we've now lost 13 people in West Virginia, and we just got updated just a second ago of a 50-year-old female in Berkeley County, and you know, like I said so many times, all these people, these are not just statistics. These people have names, and they have families, and a lot of loved ones and friends and everything. So please, let's just don't get wrapped up in a number. And you know, we just hate it, and us all just keep them in our thoughts and our prayers. You know, prayer is a powerful, powerful tool that we have and that we've been given, and I think, you know, that we all need to just join in all the time in thinking and keeping these people in our prayers. So with that, again, it's just amazing. There's lots of stuff that we seem to keep cropping up that we've got to cover. You know, one of the, always, if you're a business guy or a coach, or, you know, or just a person that is just willing to step up and take a leadership role, there's always times that are the difficult times. Now, let me just make this as clear as I can possibly make this. And it may very well be that some people are going to be displeased or unhappy with my approach to this, but everyone knows that we have multiple nursing homes across our state. And in addition to that, everyone should know that we have, although they're good people that are working there in many ways, we have an antiquated system, you know, of health care, because no one could ever have devised or thought that we would have a system that would be able to handle a true pandemic. No one ever thought we would have to have such a thing. And so in some ways, it's excusable for data to come in, maybe not in a haphazard way, but data to come in late. You meaning that data is coming from a certain source and it's reported at one time, and data is coming from another source and it's reported at another time, and before you know it, you get numbers skewed and they look a little inconsistent, and then they skew back together and everything, and you can tolerate that. But now I am telling you, this I cannot tolerate. I know for a fact that we have nursing homes, and these are the most vulnerable of the vulnerable people. Now, and we have told our people point blank that when we have one person in an outbreak in a nursing home, to run to the fire and test everybody there, all the employees and everybody there. Now, we have failed in that effort, and who knows why, and everybody can come up with 1,000 different reasons and grow 1,000 bushes to hide behind, but here's how I feel, and this is just all there is to it. I'm going to get to the bottom of this, and if I truly find out that we have had individuals that purposely didn't do what their job was to do, they're going to be gone. That's all there is to it. And I'm going to tell you, if we have any nursing home incident where we have one person that tests positive and we don't run to the fire and test everybody there, we're letting these people down. There's no excuse for that in my book, and I am not going to tolerate it. You know, that's all there is to it. Maybe our best buddies, maybe people we think are doing good work, maybe people that are trying, maybe people that are tired. But I am a real believer that you do not confuse effort with accomplishment. I don't care how tired we are. I have said over and over and over, we don't rest till it's over. And I mean that. There's no smoke with this. There's no nothing. There's nobody here that's trying to grandstand and everything. I can't stand this stuff. That's all there is to it. Now, let me go on to something else, because, anyway, I've just got to calm down about that, but that really disappoints me. But nevertheless, if I could go on, workforce is an area that we've tried, and we continue to try to, stiffen up and make better and better and better. It's another situation where we had an avalanche of backlog beyond belief, 130,000, unemployment claims and everything. And we got people sitting at home waiting on that and all that kind of stuff. And we're doing better. We're doing lots better. We've had an incredible effort from the National Guard. The workforce people have really been great. Scott Atkins is doing a great job. He'll be here on Monday to update us a whole lot more. And, we know this backlog's affecting all kinds of different states and everything else. And we know from the standpoint of the self-employed and the independent contractors, you can't file yet, but we're working on it, and you're going to be able to do that real soon, and we'll catch everything up on you guys as well. But all I can tell you is that workforce and getting the unemployment checks out is doing much better. I've tried to knock down every single roadblock, even to the point in time of saying, we were waiting on that debit card to go out, and that was backlogging us about 7 days, knocked it down. So many different things. The waiting period of a week knocked it down. That was early on and everything. And now we're now taking applications on the phone and immediately turning around and getting checks out to those people, and then we'll go back and true ourselves up, as we have to. But these people have got to get their monies and got to get their checks. From the standpoint of the Paycheck Protection Program, that was the program that was designed as far as making loans that were forgivable to the Small Business Administration. There was a flood of small businesses that came in. The monies that they allocated, I think in the beginning, were $350 million, which was gone. And now they've still got a backlog of businesses and everything that are applying for those loans, and the Senate has introduced a $250 million, addition, or $250 billion addition to that, and the House, like I said before, I have no clue why in the world, how on earth somebody could come out and say we're not going to come back until May the 4th. Speaker Pelosi, I don't want to do anything here that is political. We don't have time to be political. But for God's sakes living, we do not need to have our people waiting and hurting and have someone say we're not going to come back in until May the 4th. It's ridiculous. From the standpoint of our hospital health and everything, our community hospitals naturally have done an incredible job. They've had to cancel their elective procedures, and that's hurt them financially and hurt them really bad. But there was no other place to turn. We didn't have the equipment and the supplies and everything else, and we surely couldn't be using them on elective procedures and everything. In order to provide them some assistance, I have directed DHHR, and DHHR is sending out $69 million in direct payment program checks to these hospitals in West Virginia, and maybe that'll bridge us and help us for a little bit and everything, because I know a bunch of them are really struggling. Now, let me see. I've got one other announcement, and I continue to remind you in regard to the census. Be counted. Absolutely be counted. Now look, if you believe that I'm batting for you just as hard as I can bat, and truly, I'm surely doing that. then help me and get counted, because we need absolutely you to be counted in order to be able to get real Fed dollars in here. And so help me in that if you would. I'm going to read you something that, because I've got an announcement to make here, that will really, it really pleased me, and I want to read to you. I normally don't read, but I want to read this to you. But all of us know that this pandemic has been incredibly damaging to all of us in many ways, but West Virginians have found a way to respond and rebuild with success, and we're making some really tough decisions. But with the help of our experts, I know that we will get through this in a responsible, and we will make the responsible decisions correctly. We've closed schools, we've closed restaurants and bars, non-essential businesses, and we've ordered our people to even stay home. I worked really closely with the experts from time to time, and we've made responsible decisions for the safety of West Virginians. The success of these measures we've taken is due to one thing, and that is the great people of West Virginia, and I've told you that repeatedly. We're doing well on lots and lots of things, and we've got the discipline to move forward, and I'm going to quit reading because I can't do that. I just can't do that. I've just got to speak to you from my heart and just tell you this. Along the way, we've done lots and lots of stuff, and you know that. And along the way, we've had our experts, and I've listened to them every single day. Now, from the medical community and the health of our people, the medical experts are going to win the day with me all the time. I can tell you from an economic standpoint, a lot of you out there have wondered, well, what's going to happen to West Virginia? I had our financial people come to me probably 10 to 14 days ago. Here's what they told me. They told me, Governor, we've got to act and we've got to do something really right now. Here's the deal, Governor. We're going to end up the year, June the 30th, with a $376 million deficit or greater. Now, Governor, this thing is teetotally destroying our state's finances. So, Governor, we've got $150 million that we put into the Medicaid Reserve Fund. And then we've got other dollars over here, this and that, some tax dollars that we set aside. And we can take all of that and we can get ourselves down to a number where we're still $100 or $150 million upside down. And at that point in time, Governor, we're going to need to go to the legislature. And what we're going to need to do is we're going to have to, some way, bridge back in and invade rainy day. In order to get us through this, that's what we're going to have to do. Now, in addition to that, Governor, what we need to do, and we need to do now, is we need to lay off our people. And we need to lay off lots and lots and lots of our people. And in addition to that, we need to cut social services. Now here's the guy that you elected. You elected a business guy. You elected a guy that could sit here and try to guide you through this terrible pandemic, but you elected a guy that was a business guy. Well, I know a lot about what's going on and from the federal government standpoint, and I don't know that I absolutely have the answers, but in you electing a business guy, I said to my financial people, I said, I hear you. I really respect the work that you've done because they have done great work. But I said, but let me tell you what's going to happen. None of what you say we need to do, in my opinion, is going to happen today. Now, it may very well be because we don't know the specific rules and everything as of yet. But I want you to know this because I am a real believer in, one of the older movies said, show me the money. Well, all of a sudden, just out of nowhere, the federal government has called us and said, set up a bank account just for monies that would come from us. And so we did that. Now get this, remember, Governor, we're going to be $376 million upside down. And I said, I got it, and I understand it. And then, Governor, we're going to have to cut, and we're going to have to send people home, and we're going to have to do all kinds of things that are going to hurt our state and hurt our state very badly. And I said, we're not doing that. And so all of a sudden, we set up our bank account a couple of days ago, and last night I was informed the federal government wired into our bank account $625 million. And they also said that the other half would be coming next week. Now, I'm telling you, at the end of the day, we're going to get through this. And we're going to get through this and be made whole. I've told you repeatedly as individuals and businesses to look to the stimulus stuff and work it as best you possibly can. Now, I would tell you just this, that 45% of these dollars are supposed to go to the counties and the cities. The cities. Oftentimes I forget saying the cities, but I mean it when I speak of the counties. Absolutely, I know we're hurting all across the board in all kinds of different places. I caution you this way, and I want you to hear me very, very solidly. We don't have exactly the rules as of yet. On the call just a few minutes ago with the president, repeated governors were saying over and over and over, Mr. President, will you allow us to use the shortfall in revenue on the dollars we're getting? The answer was, we're going to do everything we can do to help, but the answer was not done. So from this standpoint, we've got $625 million in a bank account right now, and we're going to get more. And I don't know specifically how we're going to be able to use it, and maybe at the end of the day, we can't use it. And if we can't use it, then we're going to have shortfalls, and we're going to have to go back to looking at rainy day or whatever it may be. But Jim Justice, does not think that's going to happen. Jim Justice believes, as your governor, as the businessman that you elected, that he's got this, and he's going to figure this out and everything. So I want to tell you that I don't think ever I have had such a thing happen as $625 million come rolling into a bank account. And my first question is, which bank is that? Because I can't imagine that, one of the banks is just sitting there and $625 million rolls into the bank. So it's a big deal. And not only that, there's going to be more come. And on top of that, there's going to be help in another way for the hospitals. There's going to be a help for higher ed, a help for K through 12. There's going to be additional ways to help that's not even included in these dollars. And on top of that, the last thing I would say is this. Every state is to receive $1.25 billion. That's half of our money right there. And the rest of it is coming next week. Now, if we receive $1.25 billion, every state that receives that, that's 50 states that are receiving that, and that totals $62.5 billion. I mean, 62, I think that's right. I hope I've done my math right and everything, but I think that's right, $62.5 billion in a program that has $300 billion to be administered to the states. You're to get a minimum of $1.25 billion, but there's still $237.5 billion out there to be distributed to all the states. And so if we can find ways to tap into a little bit of that, it may very well be that we end up with greater than $1.25 billion. It may very well be that because of the rules and whatever it may be, we're not able to use half of the 1.25 billion. But I'm telling you, this is where I've said before, this is in my wheelhouse, and we're going to be okay with this. I'd like to touch on one thing real quick, and then I'll be done. Is in the president's conference that we just got through. It was all about opening up America again. You know, there was a lot of guidelines that were, you know, that he's given us as states, as, you know, to use those guidelines in an effort to open us back up. I've told you over and over and over, you know, it would be my goal in every way, shape, form, or fashion to be able to get us back to work and to get us back to a life that is close to where we were before. But, and here's the but, and this is the but. My number one job is to protect all of you as best I possibly can. I don't like the fact that we got 13 deaths. You know, I am an absolute realist, and I know that if we don't go back to work, we're going to have more deaths from drug overdose or suicides or whatever it may be. I know that no matter what you do, you're dadgum if you do and dadgum if you don't in this situation and everything. And we will absolutely use our experts to the hilt. We will use the guidelines of the president. We will use absolutely every means possible to make the very best decisions we can possibly make. You've done great, West Virginia, and I'm really proud of you and everything. And we've led the nation in lots of different ways, and that's what the West Virginians I know will always do. We're going to be fine financially. You're going to be fine financially if you'll just work this as hard as you possibly can. And right now, the only people that are not going to be fine are the people that mess up our nursing homes and our people and let our people down and don't think I'm not going to do something about it. So anyway, thank you all so much, and we'll go from there. Thank you.
Thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Before I provide an update for over the past 24 hours, I just want to address an issue that occurred yesterday. While members of the Guard were supporting the Kanawha Charleston Health Department with the testing at the nursing home in Kanawha County, unfortunately, a member of the Guard team documenting that took a photo of one of the residents, and unfortunately, that photo for a period of time got out on a couple of media platforms. We as the Guard regret that occurred. I, as the senior member of the National Guard, will take responsibility for that mistake. We appreciate the media outlets pulling it down quickly so we could protect the privacy of the individuals involved. And I want to apologize to the family, to the individual, as well as to the Kanawha Charleston Health Department, Dr. Young, for any problems that we may have caused with that photo getting out. We put measures in place to ensure that that doesn't happen going forward. And we appreciate the citizens of West Virginia understanding that sometimes we in the Guard will make mistakes while we're doing our best to try to protect our citizens. Today, we have 619 members of the Guard on duty. We've completed 414 missions. I want to highlight a couple of things that have occurred over the past 24 hours. We received a donation from Toyota Manufacturing of 10,000 face shields, which we are currently assembling and will get out as part of the efforts to provide support to our healthcare providers on the front line. In addition, over the past 24 hours, we conducted decontamination of 11 ambulances in Kanawha County. Today, we conducted a test on a decontamination sanitization of a KRT bus. As we talked about earlier, these are all things as we move, and the governor talks about, and Dr. Marsh talks about phase 2. These are all things that are important to us as a state to make sure that we can do those things to continue to open up as the time allows and as the governor points out at the appropriate time, and maintain the security and safety of our citizens. In addition, as the governor mentioned, we're making strong progress at Workforce West Virginia, working with our partners there. Additional call numbers will roll over to the Amazon Connect over the next 24 to 48 hours. In addition, next week, a case management software will be implemented. Again, as the governor points out, with great work from the workforce staff, other state agencies, and the National Guard supporting those efforts. Yesterday, we conducted support to 53 retail operations, again, with helping with sanitization and those things we need going forward to be prepared to protect our frontline workers, as well as be prepared for what we encounter in the next phase going forward. In addition to that, a telehealth test was done with CAMC in Pocahontas County to again improve the bandwidth to provide telehealth across the state of West Virginia and in underserved areas. We continue to work with the epidemiology staff at the State Public Health Office, and yesterday they conducted in support 140 contacts with individuals on the contact tracing, which Dr. Marsh, Dr. Slimp continue to reinforce is so important for us going forward. The last thing I would leave you with is we still continue to do our military mission. And today, the Secretary of Defense recognized a member of the West Virginia National Guard assigned to our embassy in Peru. As some people will know, we have a partnership with Peru, which we've had since 1996. That individual, Captain Joe Reppert, was part of a team that helped repatriate 6,800 American citizens from Central and South America who needed to come back home as a result of the pandemic. So great work being done by our folks across the globe as we continue to support not just this effort, but other efforts we need to in the defense of our nation and the protection of our citizens. Thank you.
Thank you, General. Up next, let's go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and it's wonderful to be with people today. I am happy that General Hoyer followed the governor because that was quite a bit of news, and that's extraordinarily good for the state of West Virginia. As the governor has said, we are focused on helping move forward with the phase 2 efforts of trying to reopen the state in a safe and responsible way. Certainly, as we look at our numbers, and people have asked which numbers are we following, and we're following the number of positive cases that are coming back each day as a percent of the total cases that are done. We had a blip with the nursing home that we found, and as the governor expressed, that we look at as sort of a single large case. The last 24 hours, we had a 3% positive rate, and overall we're 4% positive. The country's still about 20%. Our case fatality rate, the number of people that have died of COVID here, is substantially less than national. Any person dying is too many, but it's about 1.66% versus nationally about 4%. So we continue to do really well. You know, I talked yesterday a bit about the Eastern Panhandle and the Northern Panhandle, and certainly we know that there's many fewer cases in the Northern Panhandle, but there are areas of other states that border the Northern Panhandle that have more activity, but it looks like today some of that activity is starting to dissipate, which is really good for us as we focus on phase 2. I want to comment just briefly on what the governor talked about around our long-term care facilities. Certainly, we understand that this is a particularly vulnerable place for people in this pandemic. And certainly, if we look around the country and around the world, we see that people who are in long-term care facilities are not only susceptible to infection with the virus, but they tend to have worse outcomes. And if you look across Europe, about half the deaths in Europe were related to people in long-term care facilities. And although we are committed to make sure that we are very consistent and test people in these facilities, because we know now from recent data that came in the last 24 hours in the journal Nature Medicine, that about half the people who infect other people infect before they are symptomatic. They are about 2.3 days to 0.7 days before they become symptomatic. So we know it's very difficult to define who might be symptomatic and who may not, which is the reason why broad testing is so important. And that's very important in our long-term care facilities, but it's also very important in our state as we think about part 2 or phase two, I had a question to ask, what kind of resources do we need? And we are working with our testing centers in the state of West Virginia. We are starting with the help of our innovation teams at our universities to start to produce some of the vital supplies like swabs and viral media to transport samples back to laboratories. And we're expanding our ability to test all the time. So this is something that will be important, but we're certainly making a lot of progress on. And I'd like to say one last thing in my comments today. You know, people would ask, what are the most important parts of phase two? And certainly the governor will instruct us on how he wants to move forward. And as we've talked about, I have the most confidence that the safety and the well-being of our citizens will be his number one priority. But similarly, we need to start our economy again. We need to get people back to work. We know that affects people's health as well. And what I would say is the most important component of our ability to get into phase two successfully is not really just the testing, is not the surveillance, is not the capacity of the hospitals only. It's really you. And what's happened, and the reason why we've done so extraordinarily well, is because of the citizens, of the people who have committed to protect themselves and each other. When we talk about vulnerable people, I've been told that don't use medical terminology. We know people that are older have a much higher chance of being in the ICU and dying from COVID. People over 75, people 65 to 75 have a much higher chance of being hospitalized. People that are overweight, much higher chance of being hospitalized. People that have high blood pressure, who have any kind of heart disease, who smoke, who have lung disease, all are at higher risk. So we have a high risk population, as you've heard, but as long as you keep doing the things that you now know how to do very well, you know, we are staying in when we don't have to be out. We are staying distance as much as we can. We are trying to, take care of our hands because we know that the virus can live on things that we touch, and washing our hands well and not putting our hands next to our face. Those are the things and the reasons why we haven't seen the kind of surge in West Virginia that many places have. That's why our mortality rate is low. That is why our case conversion rate is low. And so I would just say to people in the state who are watching, thank you, well done. And this will continue through phase two and whatever other phase we need. And by staying together and staying connected and all of us being smart and focused at supporting ourselves, each other, and our communities, we'll be just fine. So thank you.
All right, thank you, Dr. Marsh. Next, let's go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. Couple of things quickly. I want to announce that DHHR's Bureau of Public Health this morning filed an emergency rule to implement uniform social distancing guidelines to all retailers in the state of West Virginia. The standard regulations for social distancing in retail space is to make sure that they are consistent rather than have individual guidelines from county to county. This aligns with our initiative to slow the spread of COVID-19 in communities. Maintaining that 6-foot social distancing everywhere, including in grocery stores and retail stores, is important. We want to make sure that happens. The only other thing I want to mention again is during this pandemic, many people experience stress and anxiety. And the National Helpline is free. It's confidential. It's available 24/7. Treatment and referral sources are available on that line. Those seeking mental health and substance use services can call the number, which I think we may put up here, 1-800-662-HELP or 4357. You do not have to deal with emotional stress on your own. Mental health centers are open and are providing services in your community. Many of those services are available by telehealth or telephone. So visit DHHR's COVID-19 website or call 1-844-HELP help4wv to locate a mental health center in your area. So stay safe and take care of your families. Thank you.
All right, thank you. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. Our first questioner we have today is Taylor Stuck with the Herald-Dispatch.
Hi, it's Taylor with the Herald-Dispatch. So following up on the nursing homes and testing broadly at nursing homes, was it a state policy from the DHHR to have people ask for testing? Do nursing homes have to approach DHHR if they want that testing? And how would that change now? And just will there be more nursing homes that are getting help from the state? Ohio, actually, they have posted all of the nursing homes that have positive cases. So I was wondering, too, if the governor was going to do something along those lines.
Okay, I appreciate the question and everything. Clay, I think you've got the answer, better than anybody. Is that correct?
Sure, I'll be happy to address that, Governor. Thank you. And then maybe ask Secretary Crouch for any additional comments. So we are certainly committed and have created our guidance, which would say that if there is a nursing home that has a positive case, that we would come to that nursing home and assist the county health officer to be able to acquire samples from each person in the facility, the patients and the staff, because as we said before, we are uncertain today about being able to predict purely from symptoms who exactly may be COVID positive and who may not. And as we know that the nursing home long-term care facility population is very vulnerable. Now, as I said, that in Europe, about half the people who have died from COVID are in that population. But because of the great work of folks here and getting on these cases quickly and doing really good infection control, our mortality rate in the long-term care facilities now is about 7.6%, which is really quite good. And certainly that doesn't mean we're complacent at all. When it comes to listing the COVID positive patients on a website, as Ohio's done, I will ask Secretary Crouch to make any comments and to clarify anything that I've said.
Thank you. Yes, let me say that I agree with Clay, and we all agree that that's our most vulnerable population. We spent an hour on a call this morning with 400 people, 400 individuals from the long-term care community, and we heard from all of them in terms of how we go forward in the state. We started out with our state lab being the only entity to test individuals in West Virginia, to test our citizens. That has expanded as our hospitals have come online with testing and as commercial labs have come on. We've still had problems with commercial labs, taking a long time to get a response back. So it's been difficult to move forward in this area the way we want. And what we want is to test more people. And we are to the point now where we are going to test more people. We are going to make sure that our long-term care population out there is tested when there's a positive in the facility. We've moved that policy forward each day this week, and we are to the point now where we really, really want to make sure that we protect our folks and protect our employees. Without the employees in these facilities who take care of our vulnerable population, we're really at a loss in terms of their care. So we want to take care of both, and we will do that.
All right, thank you, Taylor. Up next, let's go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I wanted to go back to the governor's comments. Nursing homes were among the first places to be locked down, essentially, to the public. So my question is, did something specific happen at a nursing home today where they weren't following the rules? Also, when you talk about community spread, wouldn't one of those COVID cases have had to have come in from the public and then also create potential for community spread? I know yesterday, Dr. Marsh, we talked about how nursing homes were not those numbers aren't as significant when it comes to the overall numbers for transmission. But I just wonder, it has to come from outside because those people haven't been anywhere around. I'm sorry, I know that's long-winded in two parts.
Okay, Amanda, you know, it's breaking up a little bit. I guess the wind's outside and everything, but I think I got enough of it. I can answer it. But let me just say this: that you know, we do have an incident that's happened today. I really feel like that I was not getting all the information that was necessary for me, and not proper. We sent the National Guard. I'm not going to, you know, name who and where, but we sent the National Guard in to find out, and our health department to find out what in the world was going on. It's just as simple as just this. You know, everybody has got to know that when we have an issue, especially at our nursing homes, that we are running to the fire. We're not kind of, you know, waiting and delaying and maybe having opinions or whatever it may be. We should be running to the fire to try to do any and everything we possibly can, because we know of the risk, and we know how vulnerable it is. And we know that the very first thing that I did was say visitation, we had to eliminate it and everything. And that's way back when and everything. So I agree we're doing better, but better's not good enough to a family that's losing a loved one, you know. And these are all moms and dads to somebody, and really just better's not good enough for me. But we did have a problem, you know. We're kind of in our infancy as far as investigating it, and I'm not going to mention where it is, but I did send the National Guard in, as well as our health people, to figure out what's going on.
All right, thank you, Amanda. Next, let's go to Phil Kabler with the Charleston Gazette-Mail.
Governor, you indicated that the receiving the $625 million in federal stimulus funds, but states are still awaiting direction on whether that funding can be used to backfill budget shortfalls. Did you get any indication on when the guidance will come down as to when states either can or cannot use that money?
Phil, I can give you the best guidance that I have, and here's the thing. You know, on the call, as I said with the president, you know, just a few minutes ago, there was repeated governors that were saying, you know, it led off with the governor in Maryland and everything, and he's the head of the whole governor show and all that, and he said right off the get-go, he said in his state they were going to have like a 3.2 or something like that $1 billion shortfall. And he said, we got to do something about this from the revenue side. And he asked about it. The guy from Utah, the governor from Utah, I think, asked about it. Maybe the governor from Louisiana asked about it. I sure asked about it, you know, and put it back on his plate and everything when it came, you know, for me to speak. And so with that being said, I think the rules are supposed to come out next week. But the one thing that I always believe is just this, is, you know, when it was announced, and it was announced early that each state would receive $1.25 billion, it's like, you know, it's like something that's a dream that never seems to ever really become reality. But when they actually send the money to our state's bank account, it gets really serious real quick. And so I believe that there's going to be a way to work through this problem that we have of this tremendous shortfall in the state, as I believe that there's ways for individuals and businesses to work through as well. But literally, when somebody sends to your bank account this kind of dollars, I can't imagine that the federal government is going to call back up and say, no, we don't want you to spend that in your state. We want you to send that back to us. You know, so with all that being said, that's about, I mean, all I could give you is gut and not real live rules yet, because the rules don't come out until next week. But it was a tremendous first step, and surely good news to me last night.
All right, thanks, Phil. Up next, let's go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11's Eyewitness News in Charleston. I have a question for the governor and possibly for Dr. Marsh, and maybe General Hoyer could also chime in, and maybe even Dr. Slimp and Secretary Crouch. It's kind of an all-encompassing question for the administration. We're reporting that at the elder care facility in Jackson County, that over the last couple of weeks, there have been 7 residents test positive and 8 staff members for a total of 15. We've been receiving messages. I've been receiving messages from people in that community for several days that no information was coming from the Jackson County Health Department nor from the facility itself. And so working today, we were able to confirm that this was actually happening, and now it appears that things are moving along. So, Governor, I guess start with you and then maybe move to General Hoyer. Is it a question of someone in the administration didn't have the information that what was going on in Jackson County? That information didn't get to the right people? Was it a judgment call for some reason that we didn't start testing there as we have every other nursing facility? And as far as the National Guard's involvement, is Jackson County requesting that, asking for that, or even saying they want assistance from the National Guard?
Well, Kenny, from my standpoint, there's a lot of variations in your question, but from my standpoint, I don't know any way to speak other than the way I speak. And, everybody says, maybe it's folksy or whatever, but it's pretty direct. And I think that we have issues that we need to resolve. And I believe without any question, you and there are others that feel the same way. And the one thing I want everyone to always know, that you're going to get consistency and you're going to get truth out of me. And that's the way it's just going to be. Now, it would be premature for me to give you any more specifics. I'll let General Hoyer and Dr. Marsh or Secretary Crouch or Dr. Slimp to be able to give you more detail. But for me to give you more detail right now, all I can tell you is, I feel like that we've got an issue and I'm trying to take care of it because, well, no, I'm not trying to take care of it. I'm going to take care of it.
Kenny, the governor directed earlier in the day for the National Guard to move assets forward to Jackson County to be prepared to support the health department and the facility to conduct testing. Those assets were en route and have arrived at the location. It is my understanding at this point in time that the health department and the facility are in the process of completing the testing, and the National Guard will provide support to those 2 entities to move those tests back to Charleston to the lab for processing. And that's the latest information I have available at this time.
All right, thanks, Kenny. Up next, let's go to Stephen Allen Adams with Ogden Newspapers. Looks like Stephen might have dropped. Let's go to Haley Kosick with WOWK. All right, let's try Annie Moore with WVVA.
Did the president give you any insight today on what those guidelines might be for the return to work?
Is this Annie? I'm sorry.
This is Annie with WVVA.
Yeah.
Our question, in your discussions with President Trump, did he give you any insight as to what those guidelines are going to be for the return to work?
He gave us a lot of insight, Annie, and the only thing I don't want to do is preempt them releasing it. I think they're going to release it about 5 o'clock today or 6 o'clock today, but he gave us a lot of information, a lot of guidelines. I think the guidelines you'll find conservative, primarily without, one-upping, our president, because I'm sure not going to do that. But, primarily in the beginning to progress to what they would call phase 1, which would be some easing and some beginning of us going back to work and whatever like that. I think what you'll see is, being able to sustain a lower curve or a lowering curve and everything that will prompt you towards progressing into what they call phase 1. And then from that, you can move as you move gradually, you move into a phase 2 area and then a phase 3 area. But there's a lot of information. Like I said, I've got the book right here, and there's pages after page after page, on it. It's very, very clear. It's a good plan. And I said this to our president, today. I said, Mr. President, I've seen you over and over and over, and with the mountains of stress and worry on your face. But today, our president was pumped up, and he was, he's trying to address us moving on. We've lost an awful lot of people, and well north of 30,000, and that's terrible. But at the same time, if you just think about this, and I go back to this, on day one, all the scrambling around that you saw happening, it had to be big. And truly, I know without any question from talking to him directly that the CDC was advising him that we could lose between 2 and 3 million people. And he was on it. Now, right now, that same man is sitting with 30,000, a few over 30,000, and we're probably going to land between 55 and 65,000 deaths, which is terrible. I mean, which no one is overlooking that. But it's not 2 to 3 million. And that's because there has been the correct buttons pushed a lot of times. Now, sometimes you're not going to be able to push 100 out of 100 and everything. But today you can see a different giddy up in our president's step, and he is moving in towards trying to bring us out of this and restart our engine. Because I'm telling you, if we don't restart this engine, it's going to be really bad. And on top of all that, let me just layer in one more thing. Also, you could see in listening to the president that his very words were, "I'm mad about how this has happened," because he really, really thinks that this originated without question in China, and absolutely those people let us down, let the world down, and absolutely this has gone all over the world, and he is very, very unhappy with that.
All right, thank you. Let's go back now to Haley Kosick with WOWK.
All right, you guys got me this time?
Yeah, we got you.
All right, perfect. So my question's kind of broad because I missed this portion. I've been working on a million things at one time. So when it comes to reopening the state economically, Governor Jim Justice mentioned that it all falls on what the health experts are saying versus economy. So I just want to kind of dive more into that and where we stand. I mean, do you, Governor, feel pressure at this point, or are you confident that we will open up the state on our own terms when we are ready?
Well, let me say this: there's plenty of pressure to go around, and as far as feeling pressure, there's been pressure since day one, and I really believe this, and I don't say this egotistically, but I can handle that. But I can tell you this, that I'm not going to make a decision because somebody is pushing me in a direction that I don't think we ought to go, no matter whom it may be. I'm going to look out for West Virginians first and foremost because I love you beyond belief. I've said it over and over. Now, at the end of the day, whether the federal government is pushing one direction or our health officials are pushing another, I'm going to listen to everybody. And I'm going to err on the side of our health officials because I've got that much confidence in them. They're superstars, really and true. When you look at these people that are on this call with you right now and everything, or with you right now in this video transfer, these people are really good. And they are on their game. And we're consulting everybody all across who knows where to make sure that we make the very best decision we can possibly make. Now, the decision is going to boil down to just this. If you don't go back to work, if you just sit on the porch and everything and wait forever, we're going to lose a lot of people. And if you go back to work and you've got every duck lined up in a row and everything from hospital beds to strike teams to everything we can possibly do, this virus is still bad, and we got to watch it or it'll hurt us there too. So that's why I say, there's no perfect answer here, but absolutely we do have to restart this engine and get back to work. I mean, if we don't, just envision this just for a second. What if we let our nation slip into a full-fledged depression? You know what happens in depressions? We end up with neighbor against neighbor. And then the only way in the world we can really come together is common cause. And oftentimes common cause is war. So this thing could get way, way, way worse than where we are today. We've got to restart the engine.
All right, thank you, Haley. We have time for one more question. Let's go to Nathan Lane with Reuters.
Hello. This is Nathan Lane with Reuters. Question for the governor. We're obviously seeing some issues with nursing homes. I know that there was a big outbreak in Wayne County. I saw on the news. You're talking about problems in Jackson County. I'm not sure exactly what's going on there, but I'm hoping you can kind of reconcile those issues with some of your comments today about moving forward and getting back to work, but also some of your prior comments talking about how the state is doing much better than other states, and how the numbers are trending in the right direction. They may be trending in the right direction, but at the same time you're having these outbreaks in nursing homes which look quite troubling. I'm hoping you can kind of reconcile those two issues for me.
Well, I appreciate the question. It's a good question. It's troubling to me as well. But you've got to understand, and we all got to know, that in this situation, a pandemic that none of us have ever dealt with in any way, none of us know how to deal with it and everything. And in West Virginia, we've punched a lot of good buttons. We're going to have some shortfalls. There's no way in the world we can bat 100 out of 100. But those shortfalls are not going to just be let go. Absolutely, when we have a shortfall, we're going to do something about it. And really and truly, you're exactly right. We've got a situation at a Wayne nursing home. We've got situations at all kinds of different nursing homes that we got a problem with right now. And we've got to fix. That's all there is to it. However, if you look at the numbers tell the truth. West Virginia has done phenomenally well. West Virginia continues to do phenomenally well. And West Virginians should be really proud of themselves. We got a problem in certain areas and everything. And those problems have to be addressed. We have, and one last thing, the reporting of our nursing home or the nursing homes in Ohio is done in such a way that it is absolutely transparent. And the other thing I'm going to do on this call right now is instruct our National Guard and our health officials and everything to get that up on our website and track it just like it's being done in Ohio. We need to do that. It makes us more transparent and everything, and it'll help us. It'll just make us better. So, sure, we've got a problem here and there, and we're going to fix them.
All right, Governor, back to you.
Well, I've said a lot today, and I want to underline everything by just saying this. While you've got problems, and while you have to fix them, you still should be thankful to the people that are really giving it all their all and everything. Sometimes we make bad decisions. And if someone's making a bad decision and it's a purposeful bad decision, that's one thing that I won't tolerate at all. If somebody else just makes a mistake and a bad decision, we try to help them and all come together and try to make it right. We just don't berate people and everything, that just because they make a bad decision, we all make bad decisions and everything. I am upset because if someone has purposefully hidden something or made a bad decision, that's not acceptable. That's all there is to it. But I can tell you this, the overwhelming, by far, 99.999% of the people that have been slugging this out every day, they're tired, they've worked really, really hard, they know we're not done and everything, and they know the level of the pressure and the responsibility, and they're doing great. And I love them and I thank them for it. As we get problems, I'm going to react and I'm going to try to do something about it. But I've said that over and over and everything, and I thank you again. And the other thing is, I surely congratulate all of us in the fact that we got a whole lot of money that's come into the state, and I keep telling everybody to work the stimulus stuff individually or business-wise, and please be counted in our census. But thank you so much.